Oh my gosh. Hi, everybody. Dr. Nikita Vizniak here with the amazing.
Dr. Catherine Chung,
And today we are going to be talking about the.
hypoallergenic diet, also called the elimination diet.
All right. And of course, this information will be available for everybody from our nutrition textbook that we've done here. Dr. Chung is one of our major contributors for it. And we are showing you how you can get better and how we can help you find your way through that process. So if we flip into our handy dandy table of contents, we can work our way down to hypoallergenic diet and go to there. All right. So who is this diet for?
This diet is aimed for patients just to figure out what their food triggers are. They have some type of inflammatory process. So, for example, it would be like, I don't know, joint pain. And they kind of want to figure out if foods are causing, allergy to foods are causing or worsening that joint pain. And
Mhm.
then they try and eliminate all these different foods. So it's actually a two-tiered diet.
Yeah.
Half of it is elimination, the other half is reintroduction.
Okay. So that's maybe even another thing to talk about as well. A lot of people aren't aware the other name for this might be the elimination diet as well, right?
Hmm.
And I'm just going to talk about a little bit of research I was recently reading that was giving a systematic review, meta-analyses of recommendations from the British Medical Journal. And they were talking about things that caused musculoskeletal pain, and they didn't list nutrition as an influence on musculoskeletal pain. Dr.
What?
Chung, I think that the world understands that a little bit better, and how this hypoallergenic diet could potentially be a starting point to figure out what foods might be causing and making your symptoms worse.
Oh, 100%. Well, I see
Yeah.
that a lot in my bodybuilding patients, right? And
Mhm.
you're getting your proteins, your complete proteins in, so they'll be eating like 12 to 24 eggs a day, and then, after about 3 months of that, and then they're just like, "Man, I'm starting to have joint pain. Like, I don't know how to fix it. Let's do some acupuncture. Let's do all these things to deal with this joint pain because I'm getting old." And I'm
Mhm.
like, no, you just have to stop eating so many eggs. And lo and behold, reduce it, find other protein options, and then their joint pain just disappears.
Yeah, exactly. A varied diet is going to be key. All right. So
Mhm.
on this hypoallergenic diet, we're looking at basically elimination. What do I go down to during the elimination phase of this diet? Like, what am I eating?
So you're going down to those permitted foods down just right under there. So essentially, you're looking at fresh everything, and you're going to go low gluten, low trans fats, and low condiments and stuff. So you're not going to like do too much store-bought, say sriracha sauce or canned pasta sauces.
It's
You're going to
so
go as
hard though.
fresh.
It's so hard because people don't even realize that you're going out
Oh,
and you're eating whatever it is. I am a huge sauce guy. I love condiments on everything, but those can
yep.
often directly influence this process, right?
Yeah, 100%. And the biggest thing about the elimination diet is that you can take it stepwise, right? Yeah, we have these permitted and non-permitted foods. So on the non-permitted food side, it looks really overwhelming. And a lot of your patients will say this too. They're like, "Oh my gosh, I can't have bananas anymore. I can't have all these other oils or these tomatoes." But it's not a race. You can slowly eliminate these foods. You don't have to go all at once kind of thing. You
Cold
choose your
turkey.
top, like,
Yeah.
yeah, exactly. You choose your top six inflammatory foods, which is going to be your nightshades, dairy, gluten, and what was the other one? Dairy, gluten, and corn. So those are like your top four. You can start with there and then slowly bring that back as well, right?
Mhm.
That's the hardest part about this diet is that there are a lot of foods that are on the elimination list,
Mhm.
and it is very overwhelming for a lot of patients.
And a part of our job, and what I like about your approach in medicine as well, that we both take, is you're trying to find a minimal effective dose. You're like, you don't have to go all out on this. We're going to go ahead and gradually reduce until we can see some kind of measurable change. And then we can start to work our way off of that starting point right there, right?
Yep, exactly. But
Yeah.
it will have a massive impact. And there's always a point in the elimination diet where they're like, it's not working, meh, it's okay. And then they eliminate this one food, and then all of a sudden their migraines are gone and they're not having migraines for like 5, 6 days in a row kind of thing,
Hmm.
right?
Hmm.
So you just have to have the patients and coach your patients through the long process of the elimination diet. I think
Yeah.
that's actually one of the harder things is how long it takes.
So what do you usually recommend for the time frame on this diet?
It depends on the will of the patient, I will say, but
Their
but
internal
generally,
strength, yes.
yes, exactly. But generally, in the elimination side of things, you want to give it a good 3 to 4 week chance per food, right?
Hmm.
So then we're looking at maybe like a 4 month process, depending on how much you want to actually eliminate, and how bad their symptoms are. So with migraines, fibromyalgia, chronic fatigue syndrome, a lot of those, when you do the hypoallergenic diet, you will see a benefit sooner the more severe the condition is, or the symptoms are, essentially, right? And you see that a lot with ADHD patients as well. So you just think of that brain inflammation. So as
Hmm.
long as you reduce it even a little bit, the ADHD actually gets much better overall. Like, I had this ADHD patient, and really believed that eating marshmallows and chocolate bars every day was helping his ADHD a
Hmm.
lot. It took us probably about 4 months to really coach and convince him that the high processed sugar probably is not doing him a favor. And then
Hmm.
once we kind of took those out, replaced it with other options, he's just like, oh, like my symptoms and my medications seem to be working better. So it's not necessarily that it's going to cure everything, but sometimes, a lot of the times, it can actually make your other treatment plans, including medications, work more effectively as well. And then that will reduce the dosage of that medication too.
Excellent. So many patients don't realize that. One of the primary goals I look at when I'm treating anybody is always, how can I reduce or eliminate the medications that you have to take? Like, the problem that you have isn't a shortage of that medication. The problem is usually more systemic based, and we can have diet and lifestyle changes that can drastically influence and maybe even potentially fully eliminate the need for those medications and extra issues that you might be having.
Yeah, exactly.
Yeah. All right. So here's one of the key things here. We were talking earlier about the benefits. So we've talked about migraines, significant migraines right there. Lots of good research on that. Arthritis, reduction in symptoms with this diet as well. Gastrointestinal orders, which I know are one of your favorites. Where do you typically find yourself using this diet for patients with GI issues?
Usually, again, it's one of those like IBS issues that they are negative for any infections. So if you've done your diagnosis and they're negative for SIBO, H. pylori, or Candida, then that's where the elimination diet or the hypoallergenic diet comes into play.
Excellent. All right. And then, of course, we can see asthma potentially can show you some benefits, irritable bowel
Mhm.
syndrome, attention deficit hyperactivity disorders, atopic dermatitis. What? I can have inflammation of my skin and this will make it feel better?
Yeah, pretty much. I mean, if you think about it, the hypoallergenic diet is just an immune reaction to these foods, right? So if you're
Hmm.
not reacting to these foods, then your immune system won't be triggered to cause some itchiness and some and eczema and like worsening of your skin issues.
Excellent. All right. What are the risks associated with this diet?
You can start. The biggest risk that I see is people just end up restricting everything, and then
Hmm.
they become
Absolutely.
malnourished because they keep on cutting out more and more and more, thinking that they're doing themselves a favor, but they're really not. So that's the thing that you always want to be careful of with the hypoallergenic diet. It's a very slippery slope to become a lot to develop orthorexia,
Hmm.
or just have a very malnourished and unsustainable diet.
Hmm. All right, excellent.
Yeah.
So here we have just a sample of what a plate might look like with this diet right here. So you can look at half a plate of non-starchy vegetables and fruit, lean organic proteins, and whole grains or starchy vegetables here. And of course, avoiding any of these key aggravators here that Dr. Chung already mentioned at the very start. All right, now we know that this diet itself can be tricky and some people can get carried away with it. Again, give people your biggest tips to be successful with this diet, Dr. Chung. What do you need to do?
Go start low, go slow is the
Mhm.
biggest thing with this hypoallergenic diet. Choose the top five that you think, because everyone inherently is just like, I think it might be this.
Mhm.
Then choose those things that you naturally have an instinct for and start there. You don't have to do anything too crazy.
Mhm.
Because remember that the elimination diet or the hypoallergenic diet is the gold standard for figuring out your food triggers. You might hear about food sensitivity testing. You might hear about all these different testings, but that's just a guider to
Mhm.
determine what your triggers are. but the gold standard is the elimination. So sometimes with patients that it's just really all over the place, that's where food sensitivity testing might be really helpful, because it gives you a guideline in terms of, okay, this is how I'm going to rank the good foods and the bad foods.
Mhm.
And then that will kind of slow everything down too. So don't go too crazy. Start with your top four is what I would say.
All right, excellent. And then, like any diet, how long should I be on this before I should, give it an honest go to see results or not?
I would say give it a good 3 months. If
Mhm.
you're thinking about per food, you're looking at probably about 3 weeks per food.
Okay.
And then the grand systemic benefits, I would say 3 months.
Okay, excellent. Dr. Chung, thank you so much for your time. It's always a pleasure to have your expertise here, and we'll see you in the
Yeah.
next video.
Thank you for having me. Have a good one.
All right, see ya.